Hi, this is Jeez. This is 24th of March 2020. It's a Tuesday, and I'm basically collecting this data at 9:30 p.m. CST. So I would like to basically start out by describing my state. So I think I'm pretty safe, and then I've not been exposed. At least I don't know anybody who has a corona, and then I have been exposed to him. So I'm pretty safe. I'm self quarantined at home along with my roommate. My family back in India is doing pretty good. They are also the whole country is in lockdown. They are at home. They are safe. We feel that they are not exposed to anybody who has corona. And my brother, sister-in-law, and kids are safe in Oregon. So they are also at home. They are not going out. They are not being exposed to anybody who we know that they are exposed to coronavirus. So they're all at home, they're isolated, they have their own daily routine going on, and none of their friends are also affected. Here we in Arlington, I think my friends are also in quarantine. They are also self-isolation. They try to keep the social distance and then keep minimal outside interaction. Most of their research work is carried out from their home. So I think it's a pretty good idea. To have all these people around, and then they all understand the implications of this situation. So let us dive deeply into these numbers. I think the numbers you can see is there are 422,000 cases reported worldwide, and 18,892 people have died. 108,000 people have recovered so far. That's what we know the statistics as of today. But as we look at the other aspects, we clearly see that it was a really bad day, especially to the western front of the world. Many countries have reported multiple deaths, as well as increased number of corona cases that is seen. So let's take the total number of cases. So China is having the maximum, 81,218 cases, 47 cases reported today, and that is lesser than the number that we had from yesterday. Italy is having 69,176, 5,249 cases, which is higher than the cases which was reported a day before, and we thought Italy was going to have attained its peak and it's going to go down for the past 2 days, but it has gone up today once again. United States is coming up really high, 54,808, 11,074 cases just today. So that's like a lot. It has increased at least 1,000 in number. Spain, 40,058 and 6,922 cases. So that is lesser than previous day, but it's not by a large amount. Germany, 32,991, 3,935 cases today. So that is like slightly less than the previous day. So I think just looking at these numbers, we really feel that this rate at which the information propagates and the corona propagates is still remaining the same. There's only a slight variation. At least it is increasing in many places, especially in the United States, that we can see the effect. So so if you look at the death chart, so we see that the Italy is having the maximum death, 6,820 cases in 743 cases just yesterday. So that's like an increase from previous day. China, 30281 cases, 4 cases, but that is lesser than the day which was previous to it. Spain, 2,991, 680 new deaths today. So it's like going up way too higher than the previous day. Iran, 1,934, 122 new cases. This was roughly the same. France, 1,100, 240 cases today as reported as dead. That is higher than the previous. But United States, on the other hand, is really having a high and hard time. So 778 cases has come up in total in death. 222 death came just today. So we know that the cases is really dire in the United States, especially in states like New York, where the whole state has more than 20,000 cases of corona in total. That is like that's a very serious situation that we might have. So the governor is actually trying to make makeshift hospitals in order to accommodate the peak. So we have not reached the peak yet. So just looking at the statistics from Wuhan, so probably we might hit the plateau in mid-April. So by that time, you will have many more cases repeated, like in hospitalized. So they are preparing for the cases. They're preparing for the worst case scenario, and then try to ramp up the number of ventilators that they need, bed space they need. So they are moving into the makeshift hospitals. There are a lot of countries are on lockdown. 20% of the world's population is actually under lockdown. One of the most important country, 1.3 billion. India is on a lockdown from yesterday night. That is like technically today afternoon from here in Central Time. Uh, New Zealand is on a lockdown. UK is on a lockdown. France is in a lockdown. I think a lot of countries are in a lockdown. A lot of countries are urging other countries to be in a lockdown. India, especially when the domestic flights are grounded, so most likely they are trying to get a 21 days of no transfer of diseases to avoid the community spread as low, to reduce the community spread as low as possible. Huge effort from the government at the moment. I can also see that there is like a lot of confusion going on in terms of when the locks will be released. So I think we are talking in terms of 14 to 21 days at the least. I mean, in most of the cases. So today I think we don't have a lot of information. So yesterday I was explaining about how easy it is to transfer a disease. So probably the nature of the disease is also covered in this, and how do they replicate. The way in which they replicate is also mentioned. So we can talk about a little bit about how the countries like Taiwan has actually done a good job. So partially they have this effect from the self-isolation, but they also have a lot of technocrats. So they really had involved in this problem, and then they tried to figure out how exactly you can tackle this problem using the technology. So they have used it for tracking those people with COVID. They have tracked who all are having COVID, and then where they have traveled, they have mapped it with other people's data, and then tried to figure out which all people were exposed or possibly could be exposed. So there is a huge policy versus human interaction. It's like a human-driven, technology-driven environment that has prevented an outbreak like this. So we should all learn from this. We should all try to use the technology to our advantage, to our generation's advantage, to the most likely at this moment, in order to see how we can control, contain, and then prevent, and then get as much time as possible to develop a vaccine or a medication, or some sort of helping aid in order to get it this disease under control. I think that is the primary concern of all these countries and all these researchers at the moment. We have to involve any amount of resources that we have, especially like Taiwan, who has done a good job. Use the technology, use AI, use the existing information that we have from all around the globe in order to just propagate these new models and new technical solutions to these problems. Thank you. That's all the statistics today. So we'll meet tomorrow.